PAI recently published a study that we did with NORC at University of Chicago. And it was a survey of employed physicians, and it was really, I think, the most comprehensive survey to date of employed physicians. And it looked at hospital employed physicians, private equity, staffing agency physicians, and it was fascinating to really dive into the specific policies that those corporate entities put in place that impacted how the physicians were expected to practice, both in terms of, the number of patients they're supposed to see a day, referral practices where they might say you have to refer within our, system if it's a hospital system. Policies to try to deliver lower cost care. And so those kinds of things, right? Those things have changed physicians' perceptions of how they practice. And sometimes they can really run up against a physician's ethical responsibility to their patient. And that's what we're concerned about. So we had the opportunity in a recent comment letter to really three largest federal regulators, the Department of Justice, HHS, and the Federal Trade Commission. They issued a very broad request for information about how consolidation, how all of these acquisitions in healthcare are affecting the system. Kind of the question you just asked. Very, very broad. And it was thrilling for us because we have all of this information through our studies and the work we've done, and just the intel that we get from our board members who are like interacting with practicing physicians on a daily basis, really trying to help them navigate this environment. And we were able to lay it out in this comment letter, which is comprehensive. It's also on our website. And it really talks them through and educates them about how this changing environment, how all of these small little deals that have been going on of acquiring physician practices, right? All too small to ever really trigger any federal regulatory review, right? They don't even really trigger much state regulatory review, but how they all have transformed the system.